And we are back. Obesity is a chronic and treatable disease that has found a profound impact on the health and well being of 1 in 3 American women. Now, unfortunately, insurance coverage for obesity treatments is lacking, creating barriers and limiting access to comprehensive care options, particularly medications. Joining me now and sharing is the CEO for the Alliance of Women's Health and Prevention, Millicent Gorham, and we thank you, Millicent, for being with us.
Thank you so much, Darren, for having me.
Well, great. I want to start off because I think so many times people underplay how really difficult it is with obesity and the numbers as well as the effects. So, when we talk about obesity, what do you want us to know?
Thank you so much, Darren. The Alliance for Women's Health and Prevention wants women to know that 1 in 3 adult women in the United States is impacted by obesity, living with obesity. 57% of African American women are living with obesity. 44% of Latino women are living with obesity. Obesity impacts their physical health, their social well being, their financial well being. And we just want to make sure that women have access to comprehensive obesity care and treatment.
And when we talk about comprehensive care, I want to come to that in just a second. But when we talk about obesity affecting women in particular, the numbers are really quite alarming. At the same time, do you think that enough people know when it comes to obesity that we really have a problem? Because it's from your perspective, you want to look at it as a chronic disease.
Obesity is a chronic disease, Darren, no difference than high blood pressure, diabetes. So that's the reason why we want to make sure that women have access to comprehensive obesity care. Listen, obesity is directly related to 200 health conditions. 13 cancers are directly related to women related to obesity. And that's the reason why it's important for women to make sure that they have comprehensive obesity coverage.
We talked about comprehensive obesity care a couple of times, or at least mentioned it. Let's get into it right now. What exactly do you define as comprehensive obesity care?
Comprehensive obesity care is intensive behavioral therapy, nutritional therapy, physical activity, surgery, and anti obesity medications. So we're talking about across the continuum. That's the kind of care that we want to offer to women.
And when we talk about this, let's go a little bit further. You've got chronic obesity. It's a disease. When you talk about a disease, going to see a doctor, let's talk about insurance. Is this something that is covered under normal insurance?
Obesity care is covered by just over 50% of all companies in this country. And what we're looking to do is to help more companies, more corporations offer comprehensive care, comprehensive obesity care as a part of their health benefits package.
And there is a special campaign that you've got going on. Let's share a little bit about the campaign and how you want people to be attached.
Thank you so much. That's the Everybody Covered campaign. This is a campaign for women to be educated about obesity, to be empowered, to have crucial conversations with their employers and with their elected officials about providing comprehensive obesity care. So we want women to have these conversations so that hopefully we can get comprehensive care through Medicare, number one. We want to make sure that Medicaid beneficiaries can get comprehensive care as well. Right now, only 16 states provide comprehensive obesity care for Medicaid beneficiaries. And we want to make sure that state employees can also take advantage of comprehensive obesity care.
Having these conversations are very important. When we talk about having the conversations, bringing about awareness. As you're getting into communities and getting into circles with women, what are you finding?
What we're finding is that women need to be educated about obesity. They need to better understand the impact of obesity on their physical health. We want to make sure that they understand about how it impacts their mental health as well. And as importantly, we want women to know that women living with obesity uh, are paid less. They're paid 20% less than the women who don't have obesity. We just want to make sure that women can take care of their families, their communities, and live their best lives.
200 diseases, or I should say, yeah, 200 illnesses are actually health conditions are attached to people with obesity. And we know that's a major number. When you say a statistic like that, there are 200 health conditions that are attached to this chronic disease of obesity. What kind of feedback do you get?
The kind of feedback that we get is that women, particularly, are disproportionately impacted by obesity, high blood pressure, diabetes, sleep apnea, osteoporosis, osteoarthritis are all the kind of diseases. Again, 13 different cancers are related to obesity. So we just want to make sure that women can get comprehensive obesity care and treatment. If they can get comprehensive care for obesity, then those other diseases, diabetes, heart disease, can be stemmed.
You know, we're talking about equitable access, and that is really what's at the forefront here. How do we get to a place that we can have equitable access when it comes to this?
We can get equitable access, one, by supporting legislation like the Treat and Reduce Obesity Act that is now winding its way through Congress. It's been around for 10 years, and we're just trying to help get it over the line. That legislation will help to offer Medicare beneficiaries, our grandmothers, our mamas, our aunties, our best friends, to be able to get comprehensive care, obesity care, through the Medicare program. We want to try to make sure that the state legislators can also provide comprehensive care by dropping in bills that will help to take care of Medicaid beneficiaries as well as state employees.
So, as the campaign is rolling out, talk to me about how it's going and how things are going.
Well, we're launching the campaign now. We want to make sure that women can go to our website at everybodycovered.org to find out more information on obesity, resources that they may need to have conversations with their employers and with their elected officials.
Yeah. And with regards to health insurance, I know we talked about it just a little while earlier that is sometimes a barrier. Are we finding that health insurance companies are becoming more in the area of gracious and accepting of understanding that, first of all, this is a chronic disease, and second of all, being able to provide affordable coverage for people dealing with this?
What we would like is for women to be able to have those conversations with their employers and get the employers to better understand that, yes, obesity is a chronic disease, that they're covering chronic diseases like diabetes, like high blood pressure through their health benefits program. And we want the same for obesity. It's only fair.
Right. And if people are looking for more information, what are they doing?
We want them to go to everybodycovered.org. That's our website where they'll find great information on obesity as well as resources to have those conversations with their employers and with elected officials.
And as March is, of course, Women's History Month, and this is the month to celebrate women, putting obesity at the forefront, having those conversations, and being out in the community obviously is a benefit to raising awareness. I'll ask the question on the side of women, are they really getting the message that, you know, hey, you got 200 health conditions that are attached to this chronic disease. You've got something that you can be able to tap into to assist you in navigating. Are women really getting the message?
We want to make sure that women are getting the message by having those conversations wherever they work, they live, they play, they worship, and to make sure that they are educating themselves and their girlfriends, their mamas, their aunties about obesity and everything that we need to have in terms of stemming obesity, stemming high blood pressure, and diabetes, those other chronic diseases related to obesity.
Now, knowing a little bit about you, I know that you received several awards. I'll just, talk about them here. I mean, you got the Black Nurses Association 2022 Lifetime Achievement Award, National Action Network
Well, speak.
2021 MLK Award. Is that you?
Yeah, that's me, Darren. But speaking of that, let me give a shout out to my friends at the New York Black Nurses Association and the Greater New York Black Nurses Association. I worked with the National Black Nurses Association for 27 years, and those nurses are phenomenal. Those are the same people that we will be going to have those conversations so that they can have conversations in their communities as well.
Well, what I really wanted to get to was, given the fact that you've gotten awards and you've worked in this field for so long, how rewarding is this work when it comes to the issue of really raising the awareness about obesity as a chronic disease? As a nurse, you see a lot of things, but to really be able to tackle obesity and to be really now a mouthpiece for it, what's that mean to you given your whole life's journey?
Listen, the important thing here is that women get access to comprehensive obesity care. We want to make sure that women live their best lives, and they can do that by making sure that they are educated about obesity, the impacts of obesity on their health and their mental health and their financial health. We just want to make sure that they're living their best lives.
Millicent Gorham, thank you so much for being with us and raising the bar of awareness when it comes to obesity in women. And certainly, we've got the message out today. Thanks for being with us.
Thank you so much, Darren.
All righty. Listen, now, if you want more information, go ahead and visit the website at everybodycovered.org. And then follow them on Instagram and Facebook at everybodycovered. We tell you don't go anywhere. We'll be back with more Open coming up right after this.